Hello, friends, and welcome to this special town hall meeting focusing on COVID vaccination for children under the age of 12. I'm Christian Washington. I'm the lead pastor for Upper Room Heights here in Houston, and I'll be your host and moderator for this distinguished panel. This town hall is sponsored by St. John's Downtown, United Methodist Church, Upper Room Heights, Bread of Life, Inc., and Amazing 102.5. Our purpose here is to educate families, in particular with the latest information on the COVID virus and COVID vaccines for children under the age of 12. We are doing that so parents can make the best informed decisions about the health care of their families in the midst of this pandemic. And we have, as I said before, a distinguished panel. I just want to introduce them briefly, and then I'll get them to say a little bit about themselves in just a moment. Stephen Williams is the director of the Houston Health Department. Dr. Sarah Simmons, MD, is a family physician and Director of Health Outcomes for Bread of Life. Dr. David Persse is the Chief Medical Officer for the City of Houston. And we also have Michelle Miner, who's a Program Coordinator for Outreach and Education at the University of Houston's Community Health Worker Initiative. Y'all can give them a hand. We have a studio audience here as well. Starting with Michelle, can you just take a brief moment or two and talk about what you're doing and your role in the fight against COVID-19?
Well, as community health workers, what we like to do is go into the communities where we live, and we're trusted. People know who we are, and any health outcomes that they need to overcome, we match them with the resources that they may need. But also when it comes to COVID, it's bringing information of value so that they can make informed decisions.
What communities do you focus on?
So we are in Sunnyside, 3rd Ward, 5th Ward is coming up, Pasadena, and Southwest.
For the people who are not from Houston, tell us just about what makes those communities the ones you target.
So most of those communities are low income, so they're underserved, so that we can come in with different programs or things that maybe already exist and they're just not aware.
It's hard to explain what I do because I am the director of the health department. Our responsibility as it relates to our jurisdiction, in this case the city of Houston, is certainly to protect the health of the public. As it relates to COVID, for us it's all things COVID. We're primarily responsible for first surveillance, figuring out exactly where it is. You see evidence of that in reports regarding our wastewater. We're also involved in contact tracing, where we're really looking at preventing the spread by where they're primarily now in congregate settings. We're focusing on, although we do target certain individuals. We also run a lab that's responsible for running COVID tests, and also serves as a reference lab for the 17 surrounding counties. We operate a call center. We also are responsible for providing not only COVID testing, but COVID vaccinations.
And again, I'm Dr. Sarah Simmons. I'm a family medicine physician. I've been in practice for over 20 years, and I'm now the Director of Health Outcomes at Bread of Life, Inc. here in downtown Houston. Our role as a medical provider community is really to put our patients first, as in everything that we do, and to keep our patients safe. And in this time of COVID, as Michelle said, that's a lot about sharing accurate information, working with parents through shared decision making about making the choices that are best for their families and their children.
And I'm Dr. David Persse, and I'm the Chief Medical Officer of the City of Houston. It's actually a combined role. So one of the things I do is I'm the Medical Director for the Fire Department over their EMS, but as it pertains to COVID, I'm the local health authority within the Houston Health Department. And so in that role, I help analyze a lot of the data that we get, and as Director Williams pointed out, we have the lab, we have epidemiology, but we have to coordinate with the surrounding health departments. We advise the mayor and city council on what policies we should enact within the city, and also through events like this, try to advise the public on what is best for them. And And I usually like to discuss things when we do this, this is what we know, and this is what we don't know. And this is what we're doing, and this is what you can do for yourself. And this is when you're going to hear from us next. And so it's a lot of trying to get the right information out to the right folks so that they can best take care of themselves and their families.
My background's in management consulting, and in particular, it's strategy change. Every piece of work that I've ever done always starts with the organization I'm working with understanding their current state. Where are we starting from? And let's get a clear place of where we're starting from. And that's what I'm putting to you as a panel. Whoever wants to go and talk about this is fine, chime in. But where are we now? What is the state of Houston, Texas in particular with regard to the COVID pandemic that we're all facing?
So let me take a stab at that. So I'll answer that sort of from the epidemiology standpoint. So where we stand now is right now, today, in Houston, our numbers look good. Hospitalizations are down. The positivity rate is down. The number of new patients being hospitalized is down. The number of new cases per 100,000 is down. It's pretty low. But to put that in context, what we're seeing going on across the rest of America, including a lot of our neighboring states, Arizona, New Mexico, Oklahoma in particular, also Minnesota, Michigan, Maine, New York, New Hampshire, and others, is they are still in the upstroke of yet another big wave of Delta. So while we here in Houston are feeling pretty comfortable and getting some good news, we need to keep in context that the rest of the nation is experiencing yet another wave. It's almost all Delta, and we should absolutely expect that we're going to see that coming here in the next few weeks.
So I'll have to put a different spin on that, because what David said is absolutely true. When you look at where we are overall in Houston, we're doing fairly well. But if you start to look at those neighborhoods that you started to call out, we're not doing as well. When you start to look at, for instance, at the African American vaccination rate in a number of the communities you mentioned, it is in the middle 30%, which means that we have a lot of work to do. When you start looking at the Latino population as it relates to deaths and actually contacting COVID, those numbers are not so good. So it's really a mixed bag. I think what we need to do is to really develop a strategic ground game where we're really on the ground in the communities, dealing with people door to door, face to face.
I know, Michelle, you're actually in this right now, door to door, face to face, just picking up on what the director said. What are the biggest impediments? What are the reasons why African Americans in particular are so disproportionately low when it comes to being vaccinated?
And it comes down to trust sometimes. There's been a lot of things that have happened to the African American community. It doesn't make it right, but it also doesn't justify making an informed decision to fix it. There's a lot of questions. That's why we have to gather the right information and share that and make it available door to door.
In the midst of putting this together, the staff and the folks who are behind this offered to get questions from the community and from a number of people. There are quite a few of them, and because there are quite a few of them, we may not get to all of them in the allotted time. What we are going to do here as a matter of course is keep all the responses from all of you combined to 5 minutes per question. And there'll be prompts in the audience for us to know how far we are along that way. Which means, let me just be clear, 5 minutes total per question. And the first question that has been submitted is, remember, our focus today is on children and vaccinating children. First question, are kids really at risk of getting sick from COVID? Anybody want to take that one?
I'll start with that. The answer is yes. We're all at risk, and that includes all age groups. While when we started in this epidemic, children maybe weren't having the severity of illness, some of the new variants, and Dr. Persse, I'm sure, can speak to that, are showing us some different tactics, and children are getting ill from COVID. The other thing that we really have to consider is that children are spreading this disease unknowingly, and so when they're back at their sports and they're back in school, and I have 4 of my own, I absolutely understand. I want my kids to be out there. But when they're coming home, they're potentially coming home with an infectious disease that they can pass on to older grandparents, to people who may have compromised immune systems in their households. And so that's really where the risk lies.
I would just add one little thing. Let's also not forget that among children there is this unique phenomenon, the multi-organ inflammatory syndrome in children, which is rare but can be really devastating. And so no child needs to go through that. No family needs to suffer that terror of having their child in the intensive care unit. And the thing is that there's no predicting which child is going to have that consequence. So yeah, kids are a major concern. The numbers are low, but when it goes bad, it can go very bad.
I also think that you have to consider the fact that kids also have illnesses such as asthma, and certainly from a public health standpoint, we're concerned with that. And so all children are not at equal risk.
Follow up on that, to just turn for a moment to vaccines themselves. How do we know that vaccines are actually effective and safe for children under 12?
So I'll take the first stab at that. So first of all, vaccines in general, and then we'll talk about for kids. But vaccines in general, there's been no pharmaceutical agent, whether it be aspirin or vaccine or heart medicine, that has been under more scrutiny than these vaccines in the history of mankind. If there were major problems with these vaccines, we would know them. And in fact, we have found some problems with the vaccines, but they're really, really rare. But kind of going back to the kid situation, so the complications of kids are rare, but they're bad. So complications with vaccine are rare. The thing you need to compare it to is what are your chances of having those same complications if you get infected with the virus? And I think that the mistake that some people make is that they say, oh, if I get the vaccine, I run this 1 in a million chance of having this bad outcome. Well, I'm just not going to get the vaccine. Well, then you're asking yourself to go ahead and have that same consequence, a much greater risk of it, by getting the virus. And people subconsciously think, well, I'm not going to get infected. That's the mistake. You are almost certainly going to get exposed if not infected. So your lesser risk is with the vaccine. Now, when we talk about kids in particular, they're going under the same scrutiny as it did with the adults, but the same thing. Now, we've got over 6 billion adults have been vaccinated across the globe. The number with kids is considerably less, smaller than that. But it's still, it's enough that the FDA has felt comfortable giving the emergency use authorization. And as time goes on, that number is only going to grow. In fact, right now we have, our societies are divided up into those folks who are eager to get vaccinated, those are kind of not so sure, and those who absolutely won't, right? Well, those that are eager, those families, we have got a lot of kids that are getting vaccinated now. And again, if there was a big problem with the vaccine, I think we would already know it.
I absolutely agree, and I would add that in general, the conversation around vaccines between healthcare providers and parents is a long one. It's one that we all know well. We've had parents with concerns with vaccines for measles, mumps, and rubella, to flu every year, to all of these things. So it is scary as a parent to think about adding COVID into the equation. But I would really and what I would tell parents is that all of our evidence shows that these vaccines are safe. And I mean that in a broader sense than just the COVID vaccine. So we've got years and years of evidence on vaccines that we've been giving our children. And the researchers that do this very well. Science is an evolving subject. We're learning new things every day. But if you have concerns, your healthcare provider is the best place to start and ask those questions.
The follow-up I'd ask about that is that coming from the African-American community I came from, there is great skepticism about anything the government is going to stick in your arm. I want to just direct this to the director in particular. What is your message to a community that you come from as well about the healthy skepticism based on history about vaccines?
Well, I do think it is a healthy skepticism because we do have that history. But when you look from a factual standpoint at how long it took to actually develop this vaccine, it just wasn't developed in a few months that people focus on. It was in development over 15 years. It really gets down to what David was talking about, and that is, what risk are you willing to take for your family, for your loved ones, and for your friends? And I have to acknowledge that I had to have those conversations with a couple of family members. I have two older sisters, and they were a bit skeptical. I visited them several weeks ago, right before Thanksgiving, and luckily they were asking me, do you think I need to get the booster? And it's like, yes, you need to get the booster. Y'all are old, and you have some underlying conditions, so please get the booster. I love y'all. But at the same time, I have a young nephew, and I wasn't able to convince him to get the vaccine. I think it really boils down to really having people that folks trust talk to them and sharing information over time. I'll give you an example. We have a doctor who is working in our TB clinic. She had 12 patients that she was trying to get vaccinated. And initially, they would not take the vaccine. We offered gift cards. She said, they told her, all 12, keep those gift cards. But it was only after they engaged with conversation with her through several visits that they, in fact, took the vaccine. And she said what they told her is that we're taking this vaccine because we know that you care about us. It's a matter of that human touch and that emotional contact that I think will move people to a point where they'll take the vaccine.
Michelle, has that been your experience as well?
Exact same. There's really nothing to add. It's the exact same conversation.
A couple of quick questions that came that I think I'll put together. What are concerns, and these are things that are out there in the zeitgeist about the vaccine and other vaccines. What are concerns about with fertility or developmental problems from the vaccine, and what are some side effects you might expect in children?
Yeah, so there's a lot of information out there, and sometimes it's hard to know what that information, where it comes from, what to trust, and sometimes it seems to change on a day-to-day basis, and so it makes us concerned about if we're making the right decision today. Again, you know, as has been pointed out well, the long history of the development of this vaccine is much longer than the short period that we've talked about it. And there are no concerns for fertility or developmental issues in children with this COVID vaccine. The most common side effects, while there are some rare concerning side effects, the most common side effects are initial problems like fever, soreness at the site of injection, maybe some redness or swelling. You know, you're not probably going to feel great for a day after you take a vaccine, but in the long run, that immunity is a good thing. That's your body's immune system responding, taking in that vaccine, and preparing you for potential exposure in the future.
Yeah, I would say, since we're talking about with kids, the complication of myocarditis in children has gotten an awful lot of press. And so there's 2 points I want to make about it. One is that, yes, that has been measured. It's extremely rare. It's like 1 in 100,000 to 1 in a million. It's extremely rare. Nearly every one of those kids recovered with no treatment. They went in the hospital, they were monitored, they didn't get any particular medication, they just watched them, they recovered totally normal on their own. If you become infected with coronavirus, your chance of getting myocarditis is about 100 times greater. So I think that people are looking for a no-risk option, and that's kind of what I was getting at earlier. There is no-risk option. You can take the risk with the vaccine, or you can take the risk with the virus. To think you're going to take the risk of not getting either, that's the mistake. You're either going to get vaccinated, or you're going to get infected. One of the two, and sometimes both.
Let's just move to the idea of the practical side of getting a child vaccinated. The questions that have come up are questions like, let me start with, how do you prepare a child for getting vaccinated and the experience of that?
Well, I'll start. I think that you have to be honest with them and let them know what they might experience. Maybe a little soreness in the arm, it might swell a little bit or whatever, and just let them know that they're likely to be okay. They might feel a little fatigue, you know, a day after or whatever, and just be straightforward so that when they start to have those experiences, it really won't frighten them. I had the experience of talking to my grandson because he's gone out to vaccination clinics with me, and it was time for him to get a shot. And he was worried about the needle going in his arm, but a week before that, he had to have 5 stitches in his head. And what I said was, the needle in your arm is not going to be like the needle that went in your head to numb your head when the doc had to put the stitches in there. So he was okay after that.
I still remember growing up and having to get mandatory vaccinations to go to public school in California. And I still remember all the tears I cried before, and then how much of a hero I felt like after when they'd say, I'm good. And then there'd usually be candy, actually, as well, which would also make a big difference.
I can add one thing to
Please.
that as well that I think is important. You know, I think it's important that we acknowledge that our kids are hearing all these conversations that are happening in the public, in the media. They're going to have concerns. They may have some fears. And so addressing some of those mental and social concerns, you know, I make sure that I'm asking kids who are getting vaccines, do you have questions about this? And letting them ask those. You know, children of a doctor, my kids, my youngest, before the pediatric vaccine was approved, was counting down till his 12th birthday so that he could get the vaccine. He was very excited. That's one extreme. We may have other kids who are hearing some things that are scary to them. And so it's important that we acknowledge that and talk about it.
But I also think as a parent, if you're at that point where that child is getting vaccinated, if they cry, I think that's normal too, because just some children's reaction to it. I wouldn't overreact to that.
Let's pivot for just a moment to Omicron. The new variant is now has a name, a Greek letter, and here we are, Greek number, and here we are. Tell us about how Omicron, at least from what we know so far, will affect children, and if it's any different than Delta.
So I'll take the first stab at that. So the problem with Omicron is that it is so new that it's really hard to answer that question. So we're looking a lot to South Africa right now because of 2 reasons. One, they seem to have the most cases, and 2, they're doing a really good job of trying to gather as much factual information as possible. So a couple of interesting observations. They're seeing a significant increase in cases. Fortunately, a smaller percentage of those are requiring hospitalization, but also the average age of the person who is being infected and that they're recognizing is much younger than what we have seen in the United States. It's generally somewhere in the 20s, some in their 20 years of age category, that decade. So that here in the United States with Delta virus, that group tends to do fairly well. What we have yet to hear, what I've heard yet to hear in great detail is what about the little ones, the ones under the age of 10, and also what about the elder, the ones over 60? I've heard just a couple of little things, but everything I hear is, whoever writes it is qualifying that this is based on really small numbers, and so nothing to hang our hat on yet. So I'm hopeful that Omicron will cause less severe illness. The problem will be that if it infects much, much more easily, and we have a larger number of people all getting infected at the same time, even though a smaller percentage may need hospitalization, that will still be a burden on the hospitals. But to your question about kids, we just don't know yet. The other thing, since we're here talking about vaccination, is at this point it appears that the vaccines are providing at least partial protection from people becoming seriously ill. Again, it's very, very early, and while the folks in South Africa are doing a great job of trying to get on top of this and get as much information, Houston, Texas is not South Africa. They're using, they're using Pfizer vaccine and J&J, which we're using here, but we're also using Moderna, and they've got AstraZeneca, right? So they're just with the vaccines alone, there are some differences. And so we're going to have to wait and see, but.
To add to that, I think the other thing just kind of falls with the timing for children. So most kids are back in school, most kids are back in their activities, and kids under the age of 12 just haven't had the lead time to be able to be fully vaccinated. So we just have a smaller percentage of those children that are vaccinated. So those children potentially are at risk.
A real just practical question about for the families out there who are now saying, all right, after hearing this, this can qualify as getting the information I need to get my kid vaccinated. Let's kind of turn a little bit to the practicalities of that. Right now, one question that really kind of came to me that I thought was interesting was, when you get a kid vaccinated, can they stop wearing a mask? And remember, we're in Texas, y'all. People are watching us right now, and we're in Texas. This is not the most masked place. So when a kid gets vaccinated, do they still have to wear a mask to school?
The short answer is yes, they do, right?
We'll do that, say, yes, yes, yes. Well, it's advisable, and I'll let Persse speak to it more specifically, but especially in indoor settings, it is advisable.
Yeah, that's the little asterisk on that, is that yes, but if you're indoors in a crowded setting, and for everyone viewing, we're several feet apart. This is a very well ventilated space. There's not a huge crowd here. So I'm comfortable not wearing a mask in this setting. Now, if the pews were all 100% jammed full and we were a lot closer, I wouldn't, and I would wear a mask. So the same thing applies to the kids who are vaccinated, and I'm vaccinated, so I can say that I feel comfortable in this setting. But we had a discussion, and we thought it through, but I think that moms and dads, after the kids are vaccinated, they still are going to have to go sort of event by event, occasion by occasion, and make that decision. And so with the holidays coming up, one of the things is, with the family gatherings, is everybody in the family at that the dinner, New Year's Eve, whatever it is everybody there vaccinated or not? Is the event indoors or not? Is it in a big house with lots of space, or is it in a small house with a lot of people? You're going to have to figure it out.
Here in Houston, where can kids go? Where can parents go to take their kids to be vaccinated?
So the best place to start is if you have your own family physician or pediatrician, to start with your own provider. Those providers all have vaccines, and they're able, hopefully, know you well and be able to answer all of your questions, know your child. That's the best place to start. There are multiple other options. We do have an option here coming up with our partners at True Care Pharmacy from Bread of Life. If you're interested to come by for children and adults, for all of the manufacturers, on December 18th from 8 to 12, and those are free vaccines as well. Our community health worker team, including Michelle, will be here so they can help answer questions, walk you through any concerns that you might have, and help you with that.
We also have vaccine available at our 4 multi-service centers. We call those our fixed sites, and they operate Monday through Saturday. At the same time, we have a mobile unit that is operating, several mobile units or teams that are operating throughout the city. On the weekend, we are at middle schools, elementary schools, and sometimes in grocery stores. Go to our website at houstonemergency.org or houstonhealth.org to find a site that's closest to you. Although we're talking about children, if you have family members that have mobility issues and they need to be vaccinated, you can call 832-393. I need to make sure I give this the right number out.
832-393-4220.
Thank you. And we will be more than happy to actually provide in-home vaccinations for individuals who have mobility issues. I think the message here is that vaccines are readily available. You can also go to your nearest pharmacy. They are continuing to provide vaccines.
There's also one that I like personally. It's vaccines.gov, and the reason why I'm looking at the phone is because I want to say it exactly right. You text the number 438829, put in your zip code, and then it will reply with the list of vaccine sites that's local to your zip code.
There's no shortage of vaccines. If there's capacity for the entire county or the entire city in particular.
Yes.
If we want them. I don't think that's unusual for large cities in America as well. I know you, Director, work with other cities or some of your counterparts in large cities. This is pretty much standard for
vaccines are readily available.
Very good. I'm gonna close with one quick question, and then I'm going to give you all a minute or so to have a closing statement. Something you'd want to say directly to a camera to the people who are watching. But before that, one last question. Does my child have to get vaccinated if they've already had COVID and recovered?
So the short answer is yes. We all need to be vaccinated, even if we've had COVID. There is a period after you've been infected that you do want to wait, so you'll want to talk to your physician about that. But the difference is that sometimes when we have infection, the way that our immune systems respond is all a little bit different. So the how long that immunity lasts and to what level it works can be different for different people. With the vaccines, we have a very known entity, and so we can have a very consistent and reliable immune response.
And I would just say that certainly in the adult population, what we've observed is those folks who were infected and then subsequently became vaccinated have had an extremely high immune response, giving them really high levels of protection. Now, don't let anybody take that and spin that around to say, if I've been vaccinated, I should now go out and try to get infected, right? That would be a really bad idea. But
Say that again.
Yeah, do not do that. That is not a good idea. And the reason is that, we've had breakthrough cases where people have been vaccinated, and they're rare, and then they go and they get infected. And every time you get infected, it's kind of, rolling the dice to figure out how sick you're going to get. So we do know that for the most part, if you're vaccinated and you become exposed and infected, you will almost certainly get less sick than you would have had you not been vaccinated. That's pretty much a guarantee. We've seen that. But again, if you want to avoid risks, then don't take that risk. So if you are already infected, that's not a reason to not get vaccinated, because then you will probably be extremely well protected. If you're currently vaccinated, still try to protect yourself from becoming infected, because every time somebody becomes infected, it's an unnecessary risk. So why would you do that? But if you've been infected before and you're thinking about getting vaccinated, that is an excellent idea to become really well protected.
I would add to that, you made me think of a point that has come up in multiple conversations. I think it's important to say that the goal of our vaccines here are twofold. So number one, it's to help prevent the spread of infection. But number two, it's also to help prevent the severity of infection. And I think that's really important because oftentimes I get the question of, well, I knew someone who was vaccinated and they still got COVID. That doesn't mean the vaccine doesn't work. That means that they would have been more sick had they not had the vaccine. And I think that's a really important point that we all need to understand.
That's an excellent point. And just because of that, the follow-up I have to ask now is just for that clarification to come out, I need a little bit of clarification on masking. Like, what does masking actually do? People would think, oh, I get vaccinated, which means I won't get the virus. So that's not true. What is masking, and what does masking help in this fight?
I'll jump on that one, and I know somebody else wanted to add on. But so when we all wear masks, the risk in that room is extremely low. The masks are really good at keeping me, if I'm infected and I'm spreading virus, and remember two things, 40% of people who get COVID have no symptoms. So they're spreading, they never know that they got infected, they never knew they were spreading it. Of those folks who develop symptoms, generally for about 2 days before they have symptoms, they were spreading virus. So people who are early on in their infection and are able to spread virus have no idea. But if I'm wearing a mask, I'm not likely to spread it because the mask catches all the virus as I exhale air, or if I cough, or if I'm talking, or I'm singing, or whatever. The mask catches it so it doesn't spread. So that's good when we're all wearing masks, right, to keep the virus from spreading. If I am wearing a simple mask and the person next to me is not wearing a mask, but they are infected, my simple mask doesn't do a great job, because as I breathe in air, I tend to breathe in air around the mask. As I breathe it in, it doesn't do as good a job protecting stuff from coming in as it does a great job of protecting stuff from getting out. So masks are really, really effective when we all wear them.
Well, this has been a really informative panel. I thank y'all for your time. And in closing, I'd like for you each to take about 1 minute. We've got someone down there timing us too, y'all. 1 minute just for a closing statement with regard to COVID and vaccines for kids, something you'd want to leave our audience with. We'll start with you, Michelle.
That's loaded for me. So the access is there. There's plenty to go around for our children to be treated so that we can avoid or minimize them getting sick. But when I was listening to the panel, one of the things that I was thinking was, that's the best thing about science to me, is that we don't assume to know, and we're still learning, especially with these different variants and the things that are happening. We have to give them time to learn, but we still have the access that we need to prevent, hopefully, the spread of COVID. But that doesn't negate when things happen, like with the Johnson & Johnson vaccine. It was an error, or, you find out more information. But that doesn't negate all the good things that it does. We just have to continue to learn, which we should all do anyway.
Of course, the pandemic is not over. We've made significant gains, but we need to stay the course.
I just want to acknowledge that I'm tired of talking about COVID. As a doctor, I would love to go back to talking about cold and flu right about now in December and leaving it at that. But we can't let our guard down. It's still here. The good news is that we have ways that we know work to help prevent it. We have ways that we can help treat patients or manage disease and infection and spread. And I know that there's a lot of information out there. And you can find any point, and you can find a Google source that will back that up for you. I just really want to urge people to talk to and look for good, reliable sources through the CDC, through the city, through the county. Those websites are great sources. Talk to your doctor. We're not dismissing your concerns, but make sure that you're getting information from a good, trusted source.
So I would just end with one thing is that, kids are like the most important part of our society, right? And in order to best protect them, because they're so social with their friends and school and everything else, they're so social, the best way for us to protect the kids is to protect our whole community. And so you can't take your child and lock them up at home for however long this is going to take to protect them from getting infected and think you're doing it, because there's all kinds of negative consequences of that. We really need to be thinking more as a community and protect everyone in the community. And if your goal is so that it protects the kids, so be it. But the more we work together, the better off we will all be, including the children.
Well, on behalf of Upper Room Heights and St. John's and all of our sponsors, which include Amazing 102.5 and Bread of Life, I'd like to thank you, panelists, for giving your time and just showing the love you have for our community by being here and providing information. That's Dr. David Persse, Dr. Sarah Simmons, Director of Houston's Health Department, Stephen Williams, and Michelle Miner from University of Houston. Could y'all show them some love and some support out here? I'm Christian Washington. I've been your moderator for this town hall on COVID vaccines and children. I invite you to check this out and share it with everyone you know, every family you know. This is vital information. It goes into the information loop that you need to make an informed decision. And we're so glad that you've tuned in, and we thank you in advance for sharing this with everyone you know. God bless you all. Remember, you are significant, and you were created to do significant things. We'll see you soon.